The first step is to prepare the stabilizer for application. Remove stabilizer from its package. Check that stabilizer is intact and not damaged. Prepare the patient's skin. Before applying the stabilizer, the patient's skin should be clean, dry, and free of oily residue. Move the ETT to the left side of the patient's mouth and position the inflation line so that it will be out of the way during stabilizer application. Step 2 is to apply the stabilizer to the patient. Remove the release liners from the cheek pads. Pull on the cheek pads so they are out of the way and center the stabilizer shuttle over the patient's upper lip. Allow the upper lip foam to lightly touch the skin. Press the two cheek pads onto the patient's skin and hold in place until they are well adhered, approximately 30 seconds. Step 3. Secure the endotracheal tube to the stabilizer. Before applying the ETT to the stabilizer, make sure the tube surface is dry and free of residue. Clean the area of the tube to which the collar will be applied using an isopropyl alcohol IPA wipe. IPA wipe provided in package. Push the orange door release button and use the door wedge to simultaneously open the tower door and interlock collar door to the fully open position. Remove the door wedge and discard it. While maintaining the interlock collar within the tower, remove the two adhesive release liners. While firmly holding the ETT and maintaining the ETT's numeric depth marker at the level of the upper incisors, press the tube firmly against the adhesive to ensure full contact. While ensuring the inflation line does not get enclosed within the interlock collar or tower, close the interlock collar door until it latches completely. Close the tower door until it latches completely. You will hear an audible click as the door release button snaps back into the locked position. Pull on the door handle to ensure that the door is locked. Step 4. Apply the adjustable neck strap. Secure the neck strap by passing the loose end of the strap under the patient's neck and then up through the stabilizer's lower strap slot. Pull the strap upward and out, and then pull the strap downward and engage the hook and loop closure. If necessary, adjust the strap on both sides until secured. However, to minimize risk of skin injury, do not over-tighten. If the patient is going to be moved or any procedure performed that places the patient at increased risk for tube dislodgement, consider using a second strap for added securement. Step 5. Confirm appropriate depth position of the ETT. It is important to confirm appropriate depth position of the ETT both immediately before and after application of the stabilizer. Confirm proper position by listening to breath sounds bilaterally with the patient's neck in both the neutral and flexed positions. Confirm appropriate depth position of the ETT by obtaining a frontal chest X-ray with the patient's neck in the neutral position as soon as possible after completion of application of the stabilizer. Clinical judgment should guide any repositioning of the ETT.